Thank you, Pat. Did you hit it, Mary?
I did. You're all set.
Okay, my record button isn't red. Okay, no, it says recording up in the left. Okay. All right, Mary, thank you very much. We'll see you next month.
Okay, sounds good. Thank you.
Thank you, Mary.
Good night.
All right. So right now, okay, now we have three members. Scott is on the phone and Patrick and I and Rick is here. And we have Ramon is here, so, and we'd ask him to come back. So right now, let's start the meeting at 6:04. And the meeting is being recorded. Rick, do you have anything to add to the meeting agenda for tonight?
I've got one thing. It's a septic tank and sewer line replacement permit for 57 Fitchburg Road.
Okay. All right. So it's a hearing or just?
It's just a permit.
Okay, all right. And then approval of the meeting minutes from December 8th. I don't see anything up here.
Yeah, I did. I emailed those to you last week, I believe.
Okay, I'll go. Patrick, do you have any issues with the December 8th meeting minutes?
None whatsoever.
Scott, do you have any issues with the December 8th meeting minutes?
I do not.
All right, all right. So, so for 6:05, it is 6:05 now. I don't see any callers on. Ramon, because we have hearings, we have to go with the hearing at the time. Okay, so we'll get to it. We've only got two hearings, and after we do these two, we'll jump over to you. Okay.
That's fine.
Okay.
Thank you.
Yeah. So 6:05, 348 Ringe Road, Ringe Turnpike.
So that is Ramon.
Yep.
Oh.
Yeah.
He's right on. Okay. So go ahead.
You want me to?
Yeah, go ahead.
Sure. So I got an email from Ramon. I think he had sent it on the 29th, which included the variance request letter. So there was the request for the two variances that we had discussed at the last meeting. The first one was, these are both to Title V. So the first one was to reduce the offset from a well to the leaching field. Code requires 100 feet, and they're requesting the reduction down to 31 feet. The other is a request to reduce the offset from the well to the septic tank from 15 feet or 50 feet to 19 feet. And these dimensions were taken off of the proposed plan. So I just had put a plus minus when I had sent it to Ramon, just because they may have varied just slightly during construction. So those were the two variances, and I'll let Ramon go through his narrative as far as why he's asking for the variance, and what basically there's a few things that Title V looks for when you're considering a Title V variance. So one is that full compliance with the code would cause a financial hardship, which definitely would. We had talked about that the last meeting. And then the other is how they would provide an equivalent level of protection to the environment. So I'll let him speak about that part. I also got the certified mail receipts for 6 abutters, and I hadn't printed these off until today, and so it's a little bit tough to read some of the dates. So I just want to make sure it says on here that they were sent out on the 24th or the 27th or the
Yes.
29th?
I don't have them in front of me, but I believe it's somewhere around the 20. I know it was about 9 to 10 days prior to the meeting. And I actually visited every person to confirm their address, and they were okay with it as well. So I did send it out as as the board had requested.
Okay, so it was 10 days. It's just a little bit illegible on the
Yeah.
copy.
Okay.
They don't use the old school cards anymore. They use those little tiny things for the certified, and they provide you with a tracking number.
Yep.
Yep.
So I thought the deal was with Ramon, there is a financial hardship with this. He'd basically run out of money, and that we were just going to meet monthly and have Ramon join. And when he did come up with the funds, he would then complete the work. And isn't that where we were? And I bring that up because isn't that the only thing for discussion tonight is there's nothing to vote on. It's just, Ramon, you still don't have the money and we're, we just want to make sure in good faith, we're all trying to, help you, but also that in good faith, when you have the funds, you would perform the work.
Absolutely. I mean, just to let the board know, I've got a mess in my backyard that I want to get rid of, and I'm under pressure from my family to get rid of it as well. So it's one of those things where as soon as I have the funding, I want to get it out of the way. Quite frankly, I work right across from my yard, and it's a complete eyesore. There's a massive pile of I don't know what they use, concrete or whatever it is, that mixture that they use, and I've got a huge hole that I'm also concerned about. It's a pit that they dug to put excess water as they're drilling into the pit. So right now it's a complete eyesore. I need to get that done.
So really there wasn't, you still don't have the funds. So really we're just moving forward, right? Wasn't that the purpose, Rick, of the meeting?
So, I guess when we had left last time, we had, I thought said that we were going to hold a formal hearing on those two items, because we had talked about a couple of things. So one was the system going in and the issuance of the certificate of compliance. And if the system was not in compliance and variances weren't granted, then it wouldn't be possible to issue that certificate until the well was finished up. And so the reason for Ramon writing this letter and notifying the abutters was to comply with the variance procedure in Title V. And so you guys can handle it really how you want. And at the end of the day, my biggest suggestion would be whichever direction you want to go at the end of tonight, I would suggest that you put everything in front of Town Council, Deb Phillips, and have her review it just to protect the board and to protect Ramon so that we know we have a legal agreement that works and complies with the regulations.
Okay. I'll go around. Scott, is that your understanding from last week?
I'm trying to recall all the conversation we had last time around it. And, it's not just coming right back to me. I apologize for that.
Well, that's why I had him repeat it. I was a little vague on it too. So do you or Patrick, do you need a little more explanation just to give us all an update? Do you want a little bit?
I remember the large part of it was the financial hardship, and it was going to be done not immediately, but it was going to be done down the road. And so it sounds like what Rick's saying is that we need to make sure that we have the variances understood and accepted on our part before Ramon moves on.
So I guess, now that Ramon is, we talked last meeting and it was pretty informal just because we didn't have enough time to meet all the requirements that Title V has. So, that's why we had come back today so that we could kind of formally discuss it. So, I would say Ramon can kind of plead his case to the board. The board can discuss what he's asking for, which is basically to use the septic system that was installed, continue to use the existing well that's there, which isn't the 100 feet away that the code requires, and come up with some sort of an agreement with the board to allow him additional time to get the funds necessary to get that well working and put that online and comply with the code. So there's a couple of different directions you can go, and like I said, I would, whatever you guys decide tonight, I would say the hearing likely gets continued to February, so that you have the opportunity to present everything to Debbie Phillips and get her comments on it, so that if it means that you're going to have to write an enforceable agreement, that she can help us prepare that to make sure that all the I's are dotted and the T's are crossed from a legal perspective.
I mean, and I'm good with that. On the well, just as a reminder, everybody, what I remember about the well, an existing well is there. They've been using it for years, and when they went to put in the new well, it was getting very costly. The last thing that Ramon heard from his vendor was, oh, now we have to frack. That was more money. At that point, Ramon called us, said, I got to talk to you guys. This is I don't have the money. So the well alone was what, to protect Ramon, is that he would continue to test the existing well, which he has been using. And then when he gets the funds for the fracking of the other well, for the new well, he would do that. So that's what I know about the well. Is that?
Yeah, then just one more kind of important piece of information, I think, is just in 2004, when they had purchased the property, there was a Title V inspection done, and it was I think it was needs further evaluation. So basically, the inspector and the owner at the time came in front of the Board of Health, and the Board of Health approved the report as passing and allowed them to continue use of that existing well, which was only about 25 feet from the previous system, which I think was just a pit. So the system they have now is definitely an improvement. It's a little bit farther away, but the big thing is that well and the septic system were so close together, and were allowed to, because of a decision of the board in 2004, to allow them to continue to use that as long as they were testing the well. I believe it was every 6 months.
Every 6 months.
All right. Okay, so again, I just want to refresh everybody's memory about the well. And then to your point, Rick, we have two variances here that you would like us to at least listen to, and then vote however, and then I think, and approve the variances. And once we do it, we would do it based on a review by the legal counsel, whatever we.
Yeah, so I think, what my suggestion would be is, go through this formal hearing process. If at the end of the day, you three are comfortable moving forward with some sort of an agreement that allows them to continue to use the well, then we would continue this hearing and go to Debbie Phillips and ask her to draft something for the board to give the Clausos to review to see if they're comfortable with it. And then, basically just allow her to guide us through the process of getting to the point where the Clausos can continue to use the new septic installed, the existing well, and that the board still has some sort of recourse at the end of the day to make sure that new well gets finished up.
All right, let's back up to the septic system. Remind me, the new septic system is now installed?
Yes.
Okay. And was that being installed last time, Ramon? It wasn't done yet, right? Or was it?
It was completed last
Okay.
time.
So right now, he has a septic system, a new one, and built to spec. And there were some variances involved in that. So we'll talk about those. All right. So those would be the two things that you'd want, or three things. Yes, continue on using existing well with testing. And then you want us to vote on the two variances that were, and those are the setbacks from well to septic, and the other one?
Well to the leaching area and well to the septic tank.
All right, well to septic and well to leaching.
And those are now variances, Rick, because we weren't able to put the new well in.
Yeah, so
They're now new setbacks, right?
Exactly, yeah. So when you guys had approved the design originally had proposed to drill the new well, which they attempted to in the backyard, which was 100 feet from the newly installed leach field. And now, because they've run into the issue where they're down 500 feet, they're not getting any water. They don't have the funds to continue looking for water. That's kind of why we are where we are.
Yeah, gotcha. Okay.
All right, thank you.
Now,
Thank you,
Rick,
Scott. That was, yeah.
Rick, are you saying that if we were to, would we be approving these variances tentative to our legal counsel approving and reviewing?
So I guess what I'm saying is, you guys have the discussion. If you're comfortable moving forward with some sort of an agreement that would, at the end of the day, allow the Clausos to continue to use their well, with the understanding that the new well would have to be finished up in whatever amount of time you feel comfortable allowing them, then we would go to Debbie to say, how should we go about doing this? Should we grant the variances and have an enforceable agreement that allows us to go back and make sure that well gets installed, or is there a better way legally for us to go through this process?
All right, one other clarification, and I apologize. So the well to septic, well to leaching, these new distances are based on using the existing well, right?
Yeah.
The new system. All right, so we would vote, yeah, we're clear, just so everybody's, we have something in writing, is that we understood the distances, but we felt if Ramones was able to do the testing, he was in a safe environment. And then we just hope to meet monthly or a couple of months and, do you have the funds available so we can do the new well, right?
If that's what you wanted to do, I guess I would more lean on Debbie to kind of guide you as far as what the most appropriate way to do this is. It might not be meeting with Ramon monthly. It might be kind of giving them parameters to abide by as far as testing the well every certain number of
Okay.
months or whatever it might be. And then, having a date where we revisit the well that they were attempting to install.
So the only thing we're going to vote on tonight is move ahead, continue to use the new well, and then Debbie will review the two things there. That's it?
Yeah, so I would say the biggest thing is, are the three of you guys comfortable with moving forward with some sort of an agreement where I think all understand what those, parameters would be, that he would continue to use the well, that he would be testing at some interval, and that, at the end, we would have some sort of recourse to make sure that new well that's not quite working out right now would be online, and the one that they would be using to serve the house down the line with whatever time frame you guys felt comfortable with.
Okay.
So that it's not necessarily today's septic because the septic is in, and if we approve the septic today with the old well, it feels like we can't even do that without Debbie's advice anyways.
That's, I guess, what
I don't want to pass something to then try to unwind it later. I'd rather leave the septic system open so that there's always something there, and we just are talking about how long do we think we're comfortable to propose to Debbie, say, look, I don't know, I'll make up a number that monthly testing for 10 months, not to exceed 10 months or something. And at that point, once we get the well rectified, then we can vote on the package of well and septic.
Exactly. So I think there's two routes that you could take. One would be you grant the two variances to Title V that he's asking for. You issue the certificate of compliance for the septic system with those two variances in place, and then you have some sort of a legal agreement that allows that requires him to finish the installation of the well. The other route would be to continue to use the newly installed system, to continue to use the existing well, and a certificate of compliance would not be issued for the septic system until the well issue was resolved. I guess, my only concern, and what I really need Debbie's advice for, is once you issue that certificate of compliance, do you still have the ability to pursue compliance and make sure that new well is the well that ultimately serves the house?
Yeah, and Rick, is it safe to say that either one of those things separately would deem the property uninhabitable? Even if you had an approved septic system, but you didn't have an approved well, we still have the same type of scenario that we can say, you know what, that's enough. We're trying, and Ramon, I'm just talking hypotheticals here, right? So, but either one of those, they don't necessarily have to be tied together. Either one of those you can't inhabit a house without a approved well or an approved septic.
Exactly. So basically, the agreement would essentially say that the Board of Health is allowing them to do this, and you're not going to pursue enforcement as long as he's meeting whatever parameters you've laid out.
All right, can you give me the dimensions again, well to septic and well to leaching? And I guess from the existing well to the septic, was that 19 feet?
So the existing well to the tank was 19 feet.
Okay, and what is our code?
50 feet.
50 feet. And well to the leaching field?
Was 31 feet.
And what is our code?
100 feet.
100 feet. The well to leaching, I thought that's not a state thing, and the state's not 50, and we did a bylaw to.
So I think what you're thinking of is you guys have within Title V the local upgrade approvals that you can use for upgrades. So the local upgrade approvals allow you to reduce the offset from the leaching area to the well to 50 feet. And that's why it's a Title V variance, because that's not something that's specifically written in that you can approve for upgrades. It's variance that you can approve. It's just not something that's written into those local upgrade approvals.
All right, again, I was trying to understand what we were trying to get to.
It really, it's kind of weird. It made more sense when we used to have to send variances to the state. But in 2016, I think it was, they had changed the Title V to allow you guys to take care of things locally. If you remember, we used to have to send tight tanks to the state, and now you can approve them locally. So, it's a little weird where it's very similar procedure, but they're still considered two separate things. So the local upgrade approvals allow you to reduce offsets to a certain number that the code specifies. Title V variances allow you to vary from any requirements except for a couple that it specifically lists.
All right, so I'm going to go back to the original drawing that we approved in well location. And so we approved this based on, we gave some variances a while back in order for them to get the septic permit and put the well in. And were there any variances for these two distances?
I don't believe so. I think that the only variance they had asked for was a groundwater offset reduction from 5 feet to 4 feet. And then I guess they had asked for a couple more. So it was reduction of the leach field and tank to the foundation. So the leach field code requires 20 feet and they were providing 15 feet. And the tank to the foundation, the code requires 10 feet and they were providing 6 feet.
Okay. So those were all very doable. We've done those before, not an issue. It's that the drinking water is septic, is that it's why it's so sensitive.
Right.
So we can't just.
So those were based on the new well that was going to be installed.
Right.
Yeah. Yeah. So there was
Which hasn't been able to happen.
Those were 3 local upgrade approvals that they had asked for. So the reduction in the offset from the tank to the leaching field to the foundation, and then the reduction in the groundwater offset from 5 feet to 4 feet because they had sandy soil, so 2-minute perk. So those ones were granted, which you guys would typically do for an upgrade, especially
Right.
one like this where there's a really tight space. The other one isn't something that I can ever remember you guys hearing.
Okay.
Right.
So where I was going with it, I just wanted to make sure we, as a board, we all understood, we had approved it at one point, but we approved it based on these 3 variances, which had nothing to do well to septic or well to leaching field. And,
Right.
If it's 4 months from now, Ramon gets a big tax return and he has the money to do the fracking, if he's able to make the new well work, all those, the original drawings and specifications would be those 3 variances that Rick just said, and we wouldn't have the issue that we have today. So, but Rick, again, all right. So to Scott's point, you would just like to hear, continue to use the existing well, test monthly, and then we'll meet next month, and our legal counsel will review what we've decided to do here.
Yeah, so I guess, my hope would be if all 3 of you say we're comfortable moving forward with this, we just want town council to draft the agreement and kind of guide us through how we get from where we are right now to an agreement that, we can fall back on if needed. And so, the key pieces would be, how often would you want him to test the water? And what would you want him to test for? And then the other part would be, how much time are you willing to provide him to get the funds together to finish the well?
Well, I don't know how Ramon, you haven't had issues with your well previously, have you?
No, never had any issues.
So, I mean, and you test, what is it, quarterly or twice a year?
Twice a year.
And your septic field before was a pit, right? It wasn't even.
Yes, it was.
Yeah. So there were all issues on the site anyway. So So good
But,
point.
I guess I'd just add that we've disturbed ground around there now too. I mean,
Right. So,
Yep.
so if we were to do it, even if we up the testing to what, quarterly or what, every other
Right.
month?
I think didn't we walk away, Ramon, last month? You were doing it monthly or
I was doing it, I'm doing it every 6 months.
every
Because
6
that was
months?
the original agreement. When he had purchased the home, that was the agreement that had been approved previously.
Patrick and Scott, I mean, we're going to meet next month. Our legal counsel is going to review this. I guess I would just leave it as is to find out what the legal counsel would say.
Yeah, I mean, you guys will have the opportunity, with Ramon to kind of finalize things. So, those intervals of testing can be changed to whatever you feel comfortable with. So if you feel like you need some time to think about it, whether it be every 6 months, every 3 months, we can revise that once we kind of see what the agreement might look like.
Okay.
And we're all going into this with the agreement or the understanding that the situation we're in is not the desirable end game, that what we want to see is a new septic and a new well. And everything will be based on that.
Yeah.
Correct.
Right.
And
So
I
he's
do
got
have-
the new septic in, now it's just getting the well in.
Right, the well is in, it's not producing any water, so we have to frack it. If I use the funds to frack it, I won't have any funding to actually attach it to the house. And so that's gonna cost me another $6,000 to dig the trench, do all the electrical work and so forth, and the fracking is gonna be another 4,000. So that's where I'm at right now. The other question that I have is, in order for me, I did some more research based on your recommendation, Glenn, with my accountant. And yes, there is the ability to be able to provide through, a tax return, the certificate of compliance and so forth, so that I can get that 6,000 over the 4-year period to come back to me for installing the new system.
Oh, that's great.
So that's something, but I need the certificate in order to be able to get the taxes done to use that funding for the fracking. So I'm hoping to get this done this year. I don't want to go into next fall or winter with that hanging over my head. I want to get it done ASAP as soon as possible. So hopefully I don't know what the tax returns are going to yield, but if any of those funds do become available, that's what I want to use it for. It's just essentially completing this project.
Okay. And Scott was the one who suggested that, by the way, about the certificates. I don't take credit for that. That was Scott. You're gonna send anything, you gotta send to Scott. But thank you, Scott. And and that's great news that you can get that. The issue is they want a certificate. We can't give a certificate until. So guess what? If it's that close, we'll be able to work it out. So let's to move forward for everybody. The only question I would have, Rick, how does legal counsel make a decision based on these type of variances without, is it you, the engineer, sort of explain to her how this works and that it's usually 50 and 100 feet and we're at 20 and 30 and it's a dangerous situation? How is legal counsel going to make a decision on this?
So I think that's more your decision, not Debbie's. I'm more going to lean on Debbie as far as the legal agreement, because, at least from what I'm understanding, the goal would be to, if possible, issue the certificate of compliance for the system. And in order to do that, you'd have to grant the 2 variances that he's requested.
Oh, okay.
And then, your big thing is that you would like, that existing well to be taken offline and have them using the new well that they haven't been able to finish yet. And my only concern is, if you issue the certificate of compliance, do you still have recourse to be able to go back and make sure that they're using that well that they haven't been able to finish? And that's the answer that really needs to come from Debbie, because I'm not sure what ability you would have to do that if you issue the certificate. I mean, we've been through quite a few of these where we kind of got burned as far as agreements being made and people following through with their side of it. And so if not to say that you're going to do that, Ramon, but it's happened in the past. And we want to make sure that, you know, we have some sort of a legal recourse to make sure that what the board wants done at the end of the day gets done.
Well, I
Right.
would think, you know, if we can supply that certificate, knowing he'd get the money, that it would be easy enough for her to write up something and then put a phrase based on X. He has
So-
to play, so I wouldn't think
Yeah.
that would be an issue for us.
Yeah, so that would be the hope. I just want to, you know, I want to run it by her to make sure that we can do
Sure.
that. And, you know, basically try to, you know, accomplish the goals of the board and the Colazos and make sure that everybody gets what they need to get at the end of the day.
All right, so the only reason for us to approve those two variances right now, you know, existing well to the septic and leaching, is that he can get a certificate. That,
Yeah. That's why, yeah.
okay. And are you asking us to do that tonight or
No.
not?
No,
Okay.
so you continue it.
We'll continue that. So right now, tonight, and I'm trying to do this for the secretary, you really don't have to write any of this, Pat, because it's got to be reviewed, is that we're going to approve moving forward and have another hearing in February. And we approve the use of the existing well and with testing based on the agreement that's in place today. And just
Yes.
keep it at that, right?
Exactly,
Yes.
yeah.
Scott, you good with that? Just keeping the language?
Yeah.
Okay, yep. And Patrick, are you good with that? It keeps it simple for your notes?
Oh, sure. I've just written 4 pages and you want me to make it simple.
He just scratched it all out.
So if we just continue and allow, and we're saying we're okay, do we have to vote on that? But we already,
So what you would have to vote on is a motion to continue the hearing to whatever our February meeting is going to be. So if we continue with the schedule that we have, it would be February 2nd, and we could just put it at the same time, 6:05.
I
okay,
make a motion to continue this meeting to the February 2nd meeting of the Board of Health.
I second.
all those in favor say aye. Scott,
Scott, aye.
Patrick,
Patrick, aye.
Glenn Hathaway, aye. So we will proceed to next month.
So basically what I'll do is tomorrow I'll ask Brian if I can talk to Debbie and get in touch with her and you'll start working towards that. And my hope would be that we can finish this before the February meeting so that we can give the Colazos a chance to review it. And then we can all look at it at the February meeting and proceed based on Debbie's recommendations.
Very good.
Perfect.
All right, looks good. Ramon, thank you very much.
Yes, thank you. I appreciate it.
Yep, okay.
All right, take care, everyone.
Thank you, Ramon.
Good night.
So what's the added hearing?
So it's not a hearing, it's just a septic permit.
Oh, okay.
So it's for 57 Fitchburg Road, which is Wayne's old house. So I'm sure you guys have noticed that they knocked the house down. And so what they're looking to do is put the house in a different location farther back on the property and continue to use the existing leaching area. So they're gonna put in just a new septic tank and gravity feed to the existing leaching area. And yeah,
I thought that was a raised mound, that leaching area.
it is. So I'll get the plans right here.
Quick question, Debbie, her last name's Phillips, right?
Yep. So they're gonna put the house back pretty far. So right now the existing D box elevation in is 107.78. And they're gonna put the house up at contour line 113. And so they'll be able to gravity feed. It's actually the old house was to the right of the septic area.
Yeah,
The new proposed location is almost directly behind the existing leaching area. So there is an elevation drop there.
okay, all right. Okay. Any, is that it, Rick?
Yeah, so yeah, there aren't any variances. It's really just to decommission the existing septic tank and pump chamber, put the new house in where they proposed and then tie into the existing leach field with a new tank and building sewer.
So what is the
So-
vote?
Nothing.
What do we-
This just goes under the heading of septic permits, right?
Correct, yeah.
Okay, so there's no vote to be taken, period.
No.
Nope.
Okay.
No.
Any questions, Scott, on this?
No,
Patrick, any questions?
Negative.
Okay, I don't have any questions on it. Anything else for hearings?
That is it for septic.
Patrick was getting a little jittery. I told him there was hardly anything here. So,
Yeah. This
so
is going to be a quick one, you said.
I did. It's 6:39.
That's the kiss of death right there, Glenn.
We are this close. I'm telling you right
Yeah.
now. So, do you want to skip the COVID and just jump down to the 4 things down there?
Yeah, so there is, under appointments, there was one, it was David Summonsby for 23 East Ridge Road.
Yeah.
So I had got a call from him. I've been talking to the electric and light department because we've been having issues in town with people bringing campers and mobile homes onto properties. And then the electric department was giving them power. And so we had a discussion that there is a regulation that the Board of Health has that you can't live in temporary housing, which is what that's considered without approval from the Board of Health. So I think we've dealt with it one time for a property on South Main Street.
Yes.
So the supervisor at the electric and light department had said, what we're gonna find out if people are tying it into a residence or a new build or a trailer, and if it happens to be a trailer, then we're gonna deny their request to tie into power and send them your way so that you can deal with them. And this one's kind of different from the ones that we typically run into. So really the problematic ones are the ones where there's a lot on the lake, and either it's got ledge or the person can't afford to build, and so they bring a trailer on and they start living, and they don't necessarily have a means of sewage disposal. They don't have a potable water supply. People, their neighbors are following the rules, and they're not. So we're trying to deal with those, and there are quite a few of them. But this one is on East Ridge Road, and basically what he wrote me a narrative, and basically it's a 75-acre parcel. He lives out in Mass somewhere. Let me just pull it up here.
Is David on the phone or?
He's not. He had emailed me today saying that he wasn't going to be able to make it. And I emailed him back saying, I'm happy to present everything that you provided to us, but we really might need you at the end of the day for the board to make a decision. So let's see, he lives in Wenham, Mass. I'm not sure where that is. 2 hours away, he says. So he had bought this 75-acre parcel. It had a pretty dilapidated building on it that he's demoed, and he had brought the trailer there, and basically claims that he uses the property to go explore, go hunting, and he has not stayed over there. The trailer provides him a dry place to go at the end of the day and change out of his clothes and whatever it might be. So basically what he's claiming is, I don't live in it, but I do have a trailer on the property that I use, and it's mostly for when I go hunting on the property. It provides me some shelter at the end of the day.
So again, without him here, there's no.
I think it's really, it needs to be a little bit more back and forth, with him. So if you guys are okay with it, I'll provide him another date. I mean, he's not using the property at all. He said that everything's winterized. His main goal is basically to get power to the trailer so that he can get an internet connection, because there's no service there. And his concern is that if he's out hunting and some sort of an accident occurs, that that he can't make a call or anything, and the Wi-Fi would provide him the ability to do that.
Yeah, it's sort of a catch-22. It's the same as with what we just previous discussion. Once you allow it, it's there. So how do you regulate that other than don't let it happen?
Well, yeah, I think, there's trailers on a bunch of properties, and the toughest thing with them to determine is whether or not they're sitting there and, they're being used for things other than sleeping in it. Because really, the only thing that our regulations say is that you can't use it as a habitable space, which would mean that you're basically sleeping in it.
Yep.
So, he's claiming that he's not using it as a habitable space, and it is, hard to regulate, because if you wanted to believe him and take his claim, then there's really no decision for the board to make. But the bigger thing is that he wants to bring power onto the property, and as soon as somebody brings power onto the property, it certainly makes it seem a little bit more permanent than just a place to go and dry off at the end of the day.
All right.
Yeah, because those people on the lakes that have a trailer parked there and they're saying, well, I'm just drying off before I drive home every night. And we
Yeah.
know that's usually not the case.
Exactly.
So how do we decide that this guy can do it versus people on the lake can't?
Well, how do we decide electricity anyways, right? I mean, I guess it becomes, once he brings electricity, it becomes our thing to say you can't inhabit the place on a whatever regular basis. I forget during that meeting, 30 days a year or something amount. I
Yeah.
forget what that
30
regulation
days
was
is
there.
what you guys can grant. Yeah.
Yeah, I mean, it feels like the electric company kind of pitched it over the fence to us on this one. He's nothing but a person with a pole on his land to us until he inhabits more than 30 days.
Yeah,
Right.
so it's you can't inhabit it at all. You guys have the ability to grant permission to do it for up to 30 days.
Oh,
Oh, I see.
all right. All right. So you recommend, yeah, go ahead.
You want to just have him come back in February? See if he can make that meeting.
Sure.
Well, what do we hope to learn? I mean, whether I talk to him or not.
I'm not
right?
sure that there's so much more to do. It's are you comfortable with what he's saying, or are you not? And if you're not, then let's give him the opportunity to have a back and forth with you guys to see if maybe there's some sort of a way where he might get what he wants at the end of the day, which really seems to be an internet connection, and you feel comfortable with it. And I'm not sure if there is anything that he could do to make you feel comfortable, but at least to provide him with that opportunity.
I would ask, in our present community, are there, 30 lots like that or 10 lots like that? Or do we even know what's going on? And to Patrick's point, there's some lots on the lakes, people drive up during the summer and there's an RV there or something. And if they have power, it allows them to be there longer, whatever. So is there anything in place, right? Do you know of any places are there dozens of lots like this?
As far as trailers, so his isn't
And
his isn't lakefront. That just seems to be where we have those issues with the trailers is lakefront. So his is a landlocked 75-acre parcel. But with the ones that are on the lakes, I'm aware of at least 6 of them that I need to send letters to.
Oh, okay. All right. All right. Scott and Pat, are we opening it up that if we do it for this guy, you do it for everybody, and then how do you monitor that? It's just what resources do we have to go out and do it? It's Rick, it's one person. And some of that's typically, it's the same as this COVID, it's typically a neighbor who complains. So usually.
Right. And not for nothing, couldn't he just shop for a cell service that would take care of where he's hanging out in Ashburnham?
It doesn't help the argument, though.
Maybe.
Hey, Patrick, I can't go behind the hair place, the sushi place. I can't get any connection there.
Don't worry, my house sucks for phone reception.
Yeah, okay. So what's that
So,
river?
so this guy, according to online anyways, Rick, 72 acres, 2,000 feet of road frontage. So I don't think this one's landlocked, but and it's not, it had an old antique colonial on it that he probably was talking about that said needs a lot of work. So that's probably the tear down, right?
Yeah, so he already tore it down, and I guess by landlocked I mean it's not waterfront.
Oh yeah. So I guess, Patrick and Glenn, I don't know. I guess I'm still stuck in the place that the electric company is sending to us, that the two things are independent of one another. If they want to put electric there, that's up to them. I don't think I have any say in what they do with the electric company. It only becomes our concern if he chooses that he wants to try to live in an RV there without permission, right?
Yep,
And
exactly.
that's
I
a
don't
good
know that I'm
point.
hearing that right now.
Right.
Yeah,
So-
I agree.
Okay. So I mean, I guess what you're saying is correct. We really can't stop him from getting electric to the property. It was kind of, a way for us to at least be aware of an issue before it became an issue. And I'm not sure that this circumstance, or at least what he's laid out for us, presents a problem for the Board of Health.
Well, it gets a problem, is it an occupied lot now? And now is he taxed for unoccupied woodland? Oh, wait a minute, he's a trailer and he stays there 6 months. I mean, it kind of snowballs.
Yeah.
The neighbor's going, wait, I'm paying taxes on a house. He's there 6 months with I think, it's not really our place.
Because, like Scott said, it's not an issue until he starts living there.
Right.
Right now, he's claiming that he has no intention of living there. If he does, then it's a Board of Health issue.
Right. Yeah.
So at least kind of at least what I was trying to do with the electric company was give us an opportunity to be aware of these before they became an issue is working. But in this particular circumstance, I'm not sure there's a whole heck of a lot for the Board of Health to do, because everything that he's claiming to do would be in compliance with our regulations.
Okay.
So it puts it on the radar, which was the intent. Rick, let me ask you this question. We'll make up a scenario that next spring he's there, and he goes there a lot more than he told us he was going to do. Can we investigate that without a complaint?
Yeah.
Or does a complaint have to kick that off?
A lot of these are complaint based, but you guys can take enforcement regardless of it's started with a complaint or it's something that you want to look into.
So remind me again the things that we have to have a complaint for before we do. It feels like that's come up over the years.
Nothing. It just happens that, there's plenty of complaints coming in, so it usually keeps us busy. We're not out actively enforcing things, but you have every right to actively enforce whatever you like.
Okay, fair enough.
Yep.
Did we
I wish we didn't have
ever,
so many problems.
Rick, I'm sorry, I'm jumping to another subject. Is that okay?
Yeah, we all done with that, right?
Yeah, as long as you guys are okay, that's what I'll go back and tell him is, and I'll just copy the electric and light department that, he can get electric out there. But here's our regulation. And if you start saying on the property, then we do intend to enforce that regulation.
Okay.
What wasn't it in our last meeting that there was the discussion about somebody wanting to rent the deli area over at the market?
Yeah.
Has there been any further discussion on that?
So at the end of that meeting, you guys had said that you would not, approve another permit until they brought, what they have into compliance. So I talked to the manager there, and, he basically said that they're considering a couple of different options, but they haven't got back to me. So one was going to be that they were going to discontinue the meat room, and they were only going to sell meats that were prepared and packaged elsewhere, which would eliminate the need for them to have a hand sink in the meat room. And then the other would be installing it. So they're, I guess, exploring their options right now, but I haven't heard back from them.
It blows my mind that we hang up plans over $1,000 hand sink.
Exactly.
Yeah.
But
Was that it,
what do
Patrick?
we know?
Patrick, was that it?
Yes, sir.
All right, I know we have the COVID, but I'm going to jump to correspondence, the National Grid Yearly Operational Plan Public Notice, the
Yep.
Ashburnham Landfill Third-Party Inspection Report. I guess I should ask, were there any issues with the report?
So the yearly operational plan is something that we get every year, and it's their herbicide control that they do. So they go and spray their lines. And then the third-party inspection report, they're just required to copy us on it, but there weren't any issues with the landfill.
Okay. Neshoba Board of Health Food Service Permit Renewals, Fitchburg Sportsman's Club, and Lucky Dragon 2. And then Neshoba Food Service Inspection, Overlook and Briggs. No outstanding issues, nothing that we
Nope.
should be concerned
Nope,
about.
just, we've
Are they
been
making
busy
any
with the,
food at all?
what's that?
Are the schools making any food?
Making or heating? They're heating.
Yeah.
Yeah, so
Yeah,
there,
For the
yeah,
most part, it's all heated stuff. They're
Okay,
not really making anything in the cafeterias anymore.
okay.
I didn't think so.
All right, so I'm going to move up to the discussion for the COVID-19 update and discussion. And right now, Scott, you were on the line, but we had 38 cases in the last few weeks, but the total from January 1st of 2020 to December 31st was 166. So I'm just bringing that up just to warm you up. And as far as any discussion, you want to give us an update, Rick?
Sure. Yeah. So, yeah, I went back through and I basically just printed out the numbers for the past month, so you can kind of see the trend and where things are going. So, what they do is they report these numbers, and it's they look at a previous 2-week period, and they provide us with the number of cases that were in that previous 2-week period. So going back to December 3rd, there were 17 cases that were reported during that 2 weeks. The next week, December 10th, we had 24 cases. December 17th, there were 35 cases. And December 24th, there were 34 cases. And then the most recent one was 38 cases. I also printed out the numbers by county. So what they do is they take the data and they interpolate it so you can compare numbers across different population densities. So your average daily incidence rate per 100,000 is 19 point, or sorry, most recently was 43.2. So if you had a population of 100,000 in a 14-day period, you would have had 43 cases. And the average for Worcester County is 61.9. So a little bit less than the average, but it's a lot of the cities and more densely populated areas that really bring those numbers up. We haven't got a ton of complaints, but I did just get one today from the police department. They had received a call that there were too many people in the nail salon downtown. So I'll go visit them tomorrow and provide them with the most recent safety standards for the close contact personal services, which covers that, and then just make them aware that right now, I think it's until January 16th, there's reduced capacity limits, so they're only at 25% capacity, and based on the number the police department gave me, they were well over that number. So I'll go and talk to them and make them aware of what the current requirements are, and hopefully get that straightened out. But really, compliance hasn't been an issue. It's just kind of the bigger issue is just people going out and getting together, and then you have just that domino effect where one case becomes 10 cases, and it just keeps on going. So we do expect that there's probably going to be an increase in cases that we're going to see in the next 2 or 3 reporting periods. So starting this week, and then the next 2 weeks, and that's going to be because of your get-togethers over the holidays. What we had seen in right around Thanksgiving was that a lot of our towns almost doubled in cases as a result. So we're hoping that a lot of people chose to spend the holidays at home, but we definitely do expect an increase, just to make you aware. So we'll see what happens. The next numbers will get reported on Thursday, and I think if we are seeing, cases as a result of the holidays. We'll start to see them then.
All right. What about vaccine shots? I've heard first responders.
Yep. Yeah, so we got our first doses of the vaccine today, and we've got some clinics set up for the first responders. So I know a couple of them were already able to get the vaccine at Haywood Hospital. They happen to have excess, so they had contacted the fire department, and a couple of the EMTs got the vaccine already. But we do have a clinic set up where we'll take care of any police, fire that haven't been already. I'm not sure when that's going to be. I believe next week, but everything's pretty fluid right now as far as the vaccine. When we're going to get it, how much we're going to get is really up in the air, and we're finding out that type of information pretty last minute. So we're working to kind of get staff together to be able to staff these clinics. People that can give the actual vaccinations. I know the fire chief, Bob Plant, had said that all of his EMTs have been trained and certified to be able to vaccinate. So he's offered his help to us to be able to run the clinics once we get to more of the general population ones. So I think things will fall together pretty well. It's going to look very similar to the flu clinics that we have. And I think by the time we get to the kind of vaccination of the general public, it's going to be available in a lot of places. So we'll kind of just be one of many options for people to go get the vaccine, whether it be at their doctor's office, at a CVS or whatever. We'll just be an option that they can come and get vaccinated at our clinic.
Where are we looking at? You said similar to the flu clinics.
Yeah. So we've always
town hall.
we've always used Oakmont. So as far as I know, we would continue to. We've done smaller clinics at the town hall, so it might depend. Once we get to the next phase where we're able to provide the vaccinations to that group that includes the pre-existing comorbidities and the elderly. I think it's over 75. Yeah. That might be a smaller clinic that maybe we'll do at a smaller location. But once we get to the general population, I would assume that we'll likely do it at Oakmont. We've explored the possibility of maybe doing a drive-through clinic. And if we did, it would likely be at the fire station because they've got the drive-in, drive-out bays. Yeah. But I know Jim's got some staffing concerns about those. So as of right now, I would assume that it's probably going to be at Oakmont, and unless things change.
I thought once you got so I'm sorry, go ahead.
Don't they want after the person gets the vaccination to observe them for 30 minutes?
Yeah, so that's kind of one of the parts. If we have okay weather, then maybe it makes sense. They did. The only reason why we're really entertaining the idea of drive-through clinics is because that's what the Department of Public Health planner is kind of pushing for. But that would be one of my concerns is, how do you watch everybody and make sure that they're not having adverse reactions to it? Because we've seen in the news and heard that people are, and so with a kind of a vaccine that was pushed through but approved, there's some concerns about that.
Right.
And we still at the double shot versus the single one isn't out yet, right?
Yeah. No, so both the Moderna and the Pfizer are both 2 vaccines.
Yeah, and we're looking at March or something like that for the single shots or something.
I haven't heard about that one, so yeah, I'm not too sure when the approval might come through on that one.
Okay, all right. There were 2. The 2 latest ones were both single shots, just a standard refrigerator as far as storage. So it was all good news on that for those 2. But the trials were just starting. This was at the middle of December. So guess what? So you don't have it. So right now we walk in, it's going to be 2 shots, 1 shot, and then so many days later you get the second.
Yeah, I think it's somewhere around 30 days in between.
Okay, all right. Have you heard just the news they were talking about in order to get more people vaccinated, that they would maybe skip the second shot on some people, and there was a lot of negative feedback on that.
Yeah.
Yeah,
I saw that, and I think the CDC came out today and advised against that.
okay. I'm sure the reason I asked in front of the, we may be asked these things, and it's on if it's on the news, we could get hit with that question. So I saw all negative response to that, other than, more people could be, could get the shot. But I guess some of the news was, that single shot, actually, the first shot, you could actually be 95%, okay on that from the first one, but the second one guarantees it or something. So
Yeah, so I think, I think this is just for the Pfizer one. I'm not sure about the Moderna one. But after you get the first shot, there was something like a 65%, yeah, 65% of the people wouldn't get the virus. And then, once you get the second one, then it's something like 95 or 96%.
okay. One thing I've been doing, you're our consultant. We contract our services through you, and nursing services, and your engineering services. I always call you. I never try. When people start asking, I'm asking because you're here, but I've been asking. I said, you know what, you need to call the Neshoba Associated Board.
Yeah.
I don't want to give out false information. So
Yeah, and I would just continue to do that because your things are constantly changing. So, recently they changed the quarantine requirements. So this would be for anybody that was a close contact of a positive person. They're quarantined, and before it was just you would be quarantined for the 14 days, and if you didn't show symptoms, then you could be released. Now that period is as little as 8 days. So you could go get tested on your 5th day of quarantine.
Yeah.
And if you test negative, then you could be released on the 8th day. So there's a lot of nuances, and it changes often. And a lot of times, as far as that stuff goes, I really refer them to the public health nurses, because that's what they're dealing with on the daily basis. And I'm more taking care of kind of simpler questions, and following up on the COVID related complaints as far as mask wearing, gatherings, those types of things.
yeah. And I don't know if people saw that the tavern closed until the 11th of January. So that's an email that went out. Wasn't anything official, other than one person passed an email, and basically Tavern on the Central was going to reopen on the 11th. So they closed over the holidays, I guess, and reopening. So I don't know if you were aware of that. So, okay. Anything else, Scott? Do you need to know anything? Any other update?
Yeah, I was just going to ask you, Rick, because I have school-age children, and we hear, my daughter's already been quarantined once because of close contact at a sport, but it feels like that Westminster's playing first chair as far as the Board of Health. Are they consulting with Neshoba as well, or?
I'd have to talk to Jim. I'm not aware of the superintendent talking to Jim anytime recently, but I really haven't been involved with that. They've been dealing directly with Jim Griffey. So I can check on that, and I can email you guys an update as far as when the last meeting took place, and whether we're still meeting on them with any consistency.
Yeah, I don't want the communication circle to break down, because all I'm hearing is Westminster, and I never hear us, right? So not that I'm trying to add work to us, but I want to make sure that, we're half the school district, so.
Yep.
Right.
Yeah, I'll check with him, and I'll send you guys an email. If you have any questions, just only reply to me, and I'll get answers for you.
All right, to
Great, thank you.
Scott's point, if things are closing, Oakmont, or I guess Oakmont, because it's the regional, are we made aware of that automatically as far as the Ashburnham Board of Health?
Not necessarily, unless they want to involve us in that discussion. So, the school districts, they can make the decision at any time which model they want to follow, whether it be the hybrid or the fully remote, or fully in person, even though that hasn't happened yet. But they can consult with us, but they could make that decision on their own at any point in time.
Okay. All right. Patrick, do you have anything?
All set.
Okay. So no other business, Scott?
Nope.
Rick, any other business?
Not that I've got. Nope.
And Patrick, no other business?
Nope.
All right, we're all set. So we're convening the meeting at 7:08. And
Very good.
if everybody's all set, I will stop the recording, Rick.
Stop the recording.
All right,